The Centers for Disease Control and Prevention recently reported skyrocketing opioid overdose rates across the nation's emergency departments. Now, after finding small success in New Jersey's busiest ER, the state's lawmakers and health professionals are looking to boost the ALTO program's implementation in the U.S. Casey Lopez reports.
Emergency departments have an emergency of their own. ERs across the country have faced criticism for oftentimes becoming patients' first contact with addictive opioid painkillers.
They're in a unique position all over the country. Because of the short-term care that emergency departments provide, they're more susceptible to doctor shopping than many other healthcare settings. And pain is one of the most common reasons for admission into the emergency department.
Today, over 100 people die each day from an opioid overdose, with the CDC explaining many think prescription opioids like oxycodone, hydrocodone, even morphine are safer than illegal drugs or alcohol. The truth is anyone can become addicted, and 40% of those daily deaths involved an opioid prescribed by a doctor. The Alternatives to Opioids in the Emergency Department Act would fund testing alternative pain management protocols to limit the use of opioids in hospital emergency departments.
More often than not, it's people in pain getting hooked on painkillers in their own medicine cabinets prescribed by their own doctors that lead to addiction. Percocet, OxyContin, Vicodin, and others. 4 out of 5 new heroin users started out initially misusing pain pills.
The bill is built on the success of a program based out of Paterson, New Jersey's St. Joseph's Regional Medical Center, which began back in 2016. Through the ALTO program, the state's busiest emergency department has successfully decreased the amount of opioid prescriptions by nearly 83%, a conscious switch in treatment protocol that Mark Rosenberg says was able to save lives, reduce opioid abuse, and lessen the burden on St. Joe's ER.
Opioids tend to cover up pain when what we use with our alternatives is targeted therapy that actually stops the pain from originating. We use trigger point injections and other non-addicting medications.
When you see communities like Colorado modeling their opioid alternative after the one right here, you know you've got a coast to coast from the mountains to the Atlantic. Here we've got a movement going.
With recent CDC data revealing emergency department visits for opioid overdoses rising 30% in all parts of the U.S. from July of 2016 through September of 2017, experts say abuse is affecting all age groups and in all geographic regions of this nation. The acting head of the CDC went as far as to say the epidemic is getting worse. Meanwhile, New Jersey lawmakers and health professionals agree emergency rooms are the first line of defense against the nation's growing problem with painkillers. Reporting for WMBC News, I'm Casey Lopez in Paterson, New Jersey.